Good evening, good Cavell, but I've thought this is a little bit outdated, so I'll go with good evening. I have some notes, and forgive me for reading some of my notes, but I had an epiphany and decided to change everything an hour ago. But I promise you it's all from my heart. So I just would like to start by saying what a privilege it is to be here, to attend this event today, and spend time and interact with my colleagues and speakers today. I learned so much from you all over the years. And from those, for those that I didn't get to meet, my name is Castro, and I'm the founder of the platform Quit Like Sweden. So inspired by the progress of Sweden towards a smoke-free future and my personal story as a daughter of a father that is a very heavy smoker, I embarked on a professional and personal mission. And last month, at the same time, with some of you that are present here today, I launched the platform Quit Like Sweden. My goal is to empower people, not only in my country, Brazil, but around the world, to regain control over their health. And I truly hope to experience a future where we prioritize saving lives from smoking-related disease and offer smokers, like my father, a chance to access alternatives to smoking so they can at least have a say on how they tackle their own dependence to cigarette. So for centuries, people have smoked. For decades, government around the world have tried to get people to stop smoking. But as Dr. Fasalino said, are countries really trying to stop people smoking when they ban alternatives and they have to resort to the most lethal form of consuming nicotines? I have seen that as well in my country, the same as the examples he gave in Indonesia and in India, where you ban and then those products are everywhere. I went to the markets where there was shop after shop selling vaping products that nobody knows where it came from. I mean, we have a hint, we think it's from Paraguay, but I didn't say that. But today, smoking rates remain high. As we've seen in the report, 1.1 billion people continue to smoke. And there is an overwhelming chance that they will die sooner or later of some form of tobacco-related disease. But it's not just death that is waiting for them. I'm being very sad now. But it's the poor quality of life of each smoker affects families and entire generations. Let's not forget this. They are not just sad statistics, they are the center of other people's life. During my childhood and youth, I witnessed what a life is of a father who leads cigarette after cigarette. So from an early age, I understood the limitations that tobacco addiction can impose on the family life of the people who smoke. On a more positive note, as I'm a positive person, like Bengt, I can finally see light at the end of the tunnel for millions of smokers, and I can see hope for those families. Today, we heard time and again, and saw in the report discussed here, something many of us has been arguing repeatedly. The answer to help smokers to reduce smoke-related disease and death is to provide them with proper, safer alternatives, like Sweden did. And we just need to walk the street of this wonderful city and see it for itself. Just yesterday, I sat down beside a lady on the plane, and she had panic of flying. And then I looked at the table. She had a kind of pouch to help her through. And I thought to myself, how wonderful that she was able to access this product, afford it, and it is acceptable to her as a unique individual that we all are. in terms of preferences, of flavors, of nicotine strength, and also that she doesn't have to feel that she's done something illegal or that other people will react negatively to it. So Sweden's approach to the fight against cigarette has been nothing short of a remarkable achievement, in my humble opinion. And if I was to wish for a miracle, I wish that other countries would be able to consume nicotine the same way Sweden does and save millions and millions in the process. But as I'm a doer and known for embracing challenges, Quit Like Sweden, or QLS for short, has big ambitions. The platform aims to encourage, assist, and enable other countries to reproduce exactly that, the Swedish experience. It's basically a hub for cooperation, so policymakers and governments, NGO, media, in fact anyone who would like to know more about it can understand how Sweden did and can try to replicate that in their respective country to fulfill the same mission. Because by now, it's clear, we must complement all those familiar cessation measures with other policies that can enable smokers to switch to safer alternatives. Like Fasalinos again said, you know, I'm loving you today, so I'm citing you a lot. The science is clear, and those products are viable alternatives, so long as, like Dylan and Frederick said, they are acceptable, accessible, and affordable. So please join me and let's make cigarette history, because to me, it's an honor to work with all of you and other colleagues and friends around the world to try to achieve this goal. So thank you for having me, and let me tell my story. Thank you.